Dear friends, there is a great myth in the society, especially among females. Do you know what is that? They think that after cesarean section, post cesarean, after the delivery, they will have back pain. That's a very, very wrong conception that's very much there in our society. What they think, especially females, is that they might have heard from their friends or their sisters or sister-in-laws, somebody in their family having undergone cesarean section, following which they have got pain in the lower back, right? So they unknowingly link it to the cesarean section. They tell, especially for following an injection that will be given during section, right? We give injection to spinal anesthesia to the lower back. So they blame it on that because there is a back pain. They think that since that injection is given, back pain has started. That's what they have in their brain. Please, 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 that's a very, very wrong concept. Please remove it. Let me explain you why post delivery females will have back pain, right? As you know, a 9 month or 9 month pregnant lady who is full term pregnancy is there, definitely her weight would have increased by minimum 6 to 7, some 8 to 10 kgs also. The child weight is added up, and since patient eats a lot of nice food, right, there will be a lot of weight gain also, there will be a lot of fluid retention also, that all those things will add to increase the body weight, right? So what happens if the patient has such a big belly? You might have seen full pregnant ladies, 9 month pregnant, how they walk, they'll be walking like this. So there is a lot of stress and strain on the lower back, right? So the lower back muscles get stretched, lower back spine gets stretched. There is a lot of load on the lower back. That's the reason, one of the reasons why patients will get back pain after the delivery. That's the one reason. Second reason is that, see, in as you know, for 9 months they will not be, most of the girls will not be allowed to do any kind of work, so they become sedentary in life, right? They don't do any stretching exercise, all those things, so that also leads to weakness of the muscles. I will tell you one beautiful scientific reason why the lower back increases following delivery. See, this is called as your vertebral column. It's like one, right? And there are two group of muscles. One is paraspinal on the one side, and another is paraspinal muscles on the other side. It works like a tripod, right? So if all the three things are strong, three legs are strong, then the load will get equally shared, right? So, but in pregnancy, because of exaggerated lumbar lordosis, we want to say, the muscles are bit relaxed, I can say. They are not being used for a period of nearly 9 months or so, and even after delivery also they won't use those muscles, because of which the muscles will also go for some amount of weakening, wasting, that we call as wasting, right? So because of with excess of load and because of this bad posture of like this, exaggerated lumbar lordosis, there will be a lot of load on the lower back bones, right? So spinal column takes a lot of brunt of the weight and all those things. That is one of the reasons why people during delivery, I mean during pregnant and after delivery, get the back pain, right? So that's the one of the reason. And there is one more, the reason is that there is one more beautiful hormone that's called as relaxin hormone. That is the hormone which is secreted during the time of delivery. See, this is the beauty of nature, how God has beautifully created. Whenever the delivery time comes, right? So that hormone is secreted, so that the name itself will indicate that's called as relaxin hormone. That will relax and stretch these lower part of the pelvis, the pubic symphysis, all those things, so that the child will comfortably come out to the mother's womb. That is the beauty of the nature. And once such hormone is produced, even that will stretch the ligaments, and that will also cause some loosening of the ligaments. And if they are not properly maintained post delivery, that can also cause pain. Definitely, it's not because of the spinal anesthesia or the epidural anesthesia which they give. The needle is so thin one, right? So the needle which they use during giving anesthesia is much more thinner than the needle which you used for taking your IM gluteal injections, right? So that's much thinner injection. That shouldn't cause any pain at all, needle prick, right? Because of all these reasons, patient after delivery, they do get the back pain, right? To avoid this, keep your muscle strengthening. After 6 weeks or so, after discussing with your gynecologist, definitely go back to your back strengthening exercises, all those things. If you go back to your posture training, you can meet your physiotherapist also. And if you strengthen your back muscles, automatically the back pain will go off, right? So don't have that wrong conception, wrong myth in your brain that post delivery there will be pain in the lower back. There's nothing to do with the injection because of the spinal anesthesia. That is because of some other stories which I already mentioned you. Please take care of those. Please take care of those kind of things. Do the proper exercise, that will take care of your back pain. Nothing to do with the injection, right? I've done so many videos like this. more than 250 YouTube videos. Please do follow it. Please do subscribe my channel, and please do follow my videos, and also forward these videos to your family members, your sister-in-law, your sister, or your daughter-in-law, especially mother-in-laws, so that they will realize and they will not just blame the cesarean delivery and keep quiet doing any work, right? All the best.